Assalamu alaikum dear aspirants. Welcome back to our channel dedicated to your CSS journey. Today we are diving into a very important topic under the subject of governance and public policy for CSS 2026. Public policy and implementation in key sectors, health and education. So these two sectors form the backbone of any country socio-economic development, and in the case of Pakistan, they are central to achieving sustainable growth and human capital development. So in this lecture, we will discuss how public policy is framed and implemented in both sectors, the key stakeholders involved, the systemic challenges, and the way forward for effective governance. Understanding these policy mechanisms is not just important for your written exam, but also for the interview and essay paper, where analytical depth is crucial. And I have also prepared PDF notes to help you revise this lecture effectively, and you can test your understanding with topic-specific MCQs through a Google Form quiz, and the links for both are available in the description below. So stay tuned till the end, take notes, and don't forget to attempt the quiz to reinforce your concepts. Let's begin. Health and education are the two key sectors that form the foundation of any country's social and economic development. In Pakistan, public policies in these sectors aim to provide better facilities to the people, improve quality, and ensure equal opportunities for all. However, merely creating policies is not enough. True success is achieved when these policies are effectively implemented to meet the national development goals. So, public policy overview हम डिस्कस करते हैं. हेल्थ पॉलिसीज इन पाकिस्तान आर बेस्ड ऑन डॉक्यूमेंट्स like the National Health Policy in Pakistan Vision 2025, for instance, to promote universal health coverage. UHC programs such as Sehat Sahulat program and have been launched to provide free healthcare service to underprivileged families. Moreover, maternal and child health as well as communicable and non-communicable disease such as TB, diabetes, and hypertension are being given attention. So another important aspect is public-private partnership, such as with the Indus Hospital or Aga Khan Health Services, which collaborate with public institutions to provide services. तो अब हम देखते हैं हेल्थ केयर इम्प्लीमेंटेशन मैकेनिज्म को. ठीक है, इम्प्लीमेंटेशन मैकेनिज्म एट द फेडरल लेवल. The Ministry of National Health Services plays a role in policy making and coordination, while each provides health department provides primary, secondary, and tertiary health care. For example, in Punjab, health care services are provided locally through basic health units and DHQ, mean district headquarter hospitals. And NGOs such as MSF and organizations like World Health Organization and UNESCO are also key partners in many programs. Then, so performance is monitored through the Health Management Information System HMIS to ensure data-driven decision making. अब हम बात करते हैं चैलेंजेस इन हेल्थ सेक्टर के. हेल्थ सेक्टर में कौन कौन से चैलेंजेस हैं. तो रिसोर्स कॉन्स्टेंट्स हैं, inadequate funding and poor resource allocation limit health care delivery. Policies are sound, serious challenges remain in implementation. So lack of resources, only 1% of Pakistan GDP is spent on health, which is very low. Then next challenge is workforce issues, shortages of health care professionals and uneven distribution across regions, shortages of doctors and nurses especially in rural areas. And infrastructure gaps भी मौजूद हैं, weak infrastructure है. Many BHUS are closed and non-functional. Governance and transparency के भी issues हैं. Corruption and poor monitoring lead to project failures. तो अब हम बात करते हैं एजुकेशन सेक्टर की. ठीक है, एजुकेशन सेक्टर जो है वो इसकी देखते हैं पब्लिक पॉलिसी ओवरव्यू. So the main reference for education policy is the National Education Policy 2021 and Sustainable Development Goal 4. So objectives include increase enrollment, improve literacy, and promoting girls' education, and introducing a modern and unified curriculum. For example, the government introduced single national curriculum to ensure uniform educational standards across countries. So additionally, there is an emphasis on technical and vocational training TVET to help you learning skills and become employable. So implementation अगर हम mechanism की बात करें education sector में, तो की प्रोग्राम्स हैं इसमें इन्वॉल्व हैं तालीम बालगा मीन एडल्ट लिटरेसी एंड वसीला तालीम कंडीशनल केस ट्रांसफर फॉर एजुकेशन. So school infrastructure development, improving school buildings, and international organizations like UNESCO and World Bank support these efforts, and EMIS education management information system is used to monitor performance. तो इसके बाद हम बात करते हैं चैलेंजेस की कि चैलेंजेस क्या हैं एजुकेशन सेक्टर में. सो देयर आर सेवरल इश्यूज इन एजुकेशन एज वेल. लो लिटरेसी रेट है मीन स्पेशली अमंग रूरल पॉपुलेशन एंड वुमेन. देन पुअर क्वालिटी ऑफ एजुकेशन है, आउटडेटेड करिकुलम एंड डिस्कनेक्शन फ्रॉम प्रैक्टिकल लाइफ. ठीक है. इसी तरह इनएडिक्वेट टीचर ट्रेनिंग है मीन अटेंडेंस इश्यूज इन सम एरियाज. Low budget allocation है, only 1%, 1.7% of GDP is spent on education, where UN recommend 4 to 6%. For example, many schools in Balochistan exist only on paper. तो इन तमाम चैलेंजेस को किस तरह से हल किया जा सकता है, तो इसके लिए जो है वो कुछ रिफॉर्म्स की ज़रूरत है. ठीक है. इन्वेस्टमेंट इंक्रीज करनी चाहिए, स्ट्रेंथ एंड कैपेसिटी एंड कम्युनिटी इंगेजमेंट की ज़रूरत है, टेक्नोलॉजिकल इनोवेशन की ज़रूरत है. ठीक है. बूस्ट पब्लिक फंडिंग फॉर हेल्थ एंड एजुकेशन sectors. If we want to progress, we must increase investment in health education and engage the public through school management committees, improve international capacity and transparency, promote technology such as e-health and digital classroom to ensure intersectoral coordination so that education, health, employment and social welfare progress together. So, in conclusion, public policy and its effective implementation in the sectors of health and education are the foundation pillars of Pakistan's development. Without giving these sectors the importance they deserve, economic progress is not possible. So, for this, it is essential that all of us, government, private sector, civil society, and the public, play a responsible role together. If you found this video helpful, please like, share, and subscribe so we can continue bringing you informative lectures on important topics.